Good morning. St. Louis County has long provided no-cost COVID testing to all residents at its 3 permanent health centers. As the Omicron variant has led to an explosion of COVID cases, demand for testing has risen sharply. Over the past 3 weeks, we've averaged about 2,000 tests per week, and the demand continues to be strong, leading to long lines in some cases. Today, I'm pleased to announce that St. Louis County will open a new testing site that will increase our capacity by another 1,000 tests per week. And here are the details. Beginning Monday, the Health Department will begin offering testing at the North County Recreation Complex. The address is 2577 Redmond Avenue. The testing site will be open Monday through Friday from 8 a.m. to 4 p.m. And because demand is so high and we want to avoid long lines and creating crowds, all tests will be by appointment only. And those appointments can be made at revivestl.com. Please do not show up without an appointment. Tests will be administered to residents in their vehicles. Unlike the existing testing facilities at our 3 health centers, which use nose swabs to collect a sample, the new site will use saliva tests. The results will be ready in 24 to 48 hours. Testing is a crucial part of our COVID-19 strategy, and we urge anyone with symptoms of COVID-19, as well as those who have been exposed, to get a COVID test and to isolate immediately. For those who have already been tested and tested positive for COVID, a second test is not necessary or recommended. Just start your isolation and follow the CDC guidelines. Also, I'd like to announce that starting today, our Department of Public Health clinics will offer Pfizer booster shots for youth aged 12 to 15. And this follows the decision late Wednesday by the CDC to authorize these shots for that age group. The shots are available to walk-up patients as well as those who make appointments. And more information can be found at our appointment page at revivestl.com. I want to encourage anyone who qualifies for a booster shot to get one. We know that booster shots strengthen our defenses against contracting COVID, and we need to use all the tools we have to fight this pandemic. We have several residents who tested positive using a home COVID test kit and have asked us whether or not they should report their results to the county's health department. While there is no reporting requirement, we've created an email account for anyone who wishes to report a positive COVID test result. And that email address is dph.submission@stlewiscountymo.gov. And that's dph.submission@stlewiscountymo.gov. For those who don't have internet access, they can call the department at 314-615-2660. We're seeing a record number of cases and hospitalizations, and that's why the County Council on Tuesday approved Dr. Khan's public health order for a mask mandate that went into effect Wednesday morning. The new order requires masks in public indoor spaces by both vaccinated and unvaccinated people ages 5 and older. Most people just want to know what the right thing is to do and do it, so they can help keep kids in in-person learning, family members out of the hospital, and our businesses open. If you haven't been vaccinated, please get a shot. Most of those hospitalized with COVID are unvaccinated. And if you're eligible, get a booster. And please wear a mask in public places. The continued pushback from those who do not follow science or the advice of medical experts is responsible for this spread. Don't listen to the noise. Listen to your doctor, listen to your family members who have become sick from COVID, and listen to common sense. The last few days have been heartening. So many of you have reached out to say thank you. People who don't get into public political debates or name calling, just people who are scared and anxious and want to know what to do to stay safe and want their elected leaders to take actions that best serve us all and not just a few. Thank you, and I'd be happy to answer any questions.
How confident are you that the mask mandate will stand
Okay, the question is, how confident are we that the mask mandate will stand up to the Attorney General's lawsuit? St. Louis County's been sued many, many times since the beginning of this pandemic and have prevailed in all cases. We were collateral damage of the Cole County case. We were not a party to that case, and we're trying to intervene and appeal that decision. But we are confident that we are on solid ground with our mask mandate. We are confident that it's the right policy decision based on recommendations from the Pandemic Task Force and our Public Health Department, and we are in unprecedented territory for this surge of COVID, and it's going to get much worse.
This is a question that may necessitate a follow-up question, but does the county health department offer like monoclonal antibodies or any treatment, or is that more of a state or hospital thing, basically?
Well, that's a great question. So the question is about the availability of monoclonal antibodies and really other therapies. There's new COVID pills that are available. Some of them are more effective against Omicron than others. All of that's the new pills are coming onto the market, and they're not readily available. There are very few of them available in the community, very few of them available at pharmacies, and the hospitals are telling me that they're reserving those for the sickest of the patients, the highest risk patients. Monoclonal antibodies are IV therapies that have to be given at an infusion center. And they are in very, very short supply. They're only given by the order of a physician at an infusion center. There are a few of those infusion centers set up across the community. Patients are triaged to monoclonal antibody therapy based on being high risk to have a bad outcome with COVID.
Yeah, so let me think about this to make sure this is a question, not a statement. Yes, the Pfizer pill is definitely not available now. My question for you is, has the health department discussed maybe 2, 4, 6 months into the future, if there's another surge, setting up clinics to dispense the pill for people? Because that seems like it's pretty effective at keeping people out of the hospital.
Okay, so the question is the health department's role in providing really broad spectrum medical care in the community. And the health department is designed to provide health care for uninsured and underinsured in the region. A relatively modest portion of the population, the vast majority of the folks, will be getting their health care through traditional health systems and their private physicians. As far as availability of the pill, I'm sure when it's readily available that the health department will add it to their list of therapies for the patient population that they take care of, which is underinsured and uninsured. But right now there is a very, very low supply of those oral therapies, those pills in the country and in our community. There are a few around, but there's not nearly enough to take care of the surge that we're in right now.
Dr. Baker, we have a couple of questions from Channel 4. You touched on the reporting of the home test kits. Without those numbers in the official count, do we have any idea how many are out there that are not being reported?
So the question from Channel 4 is first recognizing that the tests pick up a small portion of the patients, residents in our community that are positive with COVID. And I can't possibly guess what the number of what number of COVID cases are in the community that aren't being picked up by tests, but I can imagine that there are thousands and thousands of patients in our region who have COVID now that aren't being picked up in tests because they are asymptomatic or they're having trouble getting access to tests. Like everyone in our country, there are not nearly enough tests to test everyone who needs it or wants it in the middle of this surge.
And do we have any idea of how many of these home test kits are testing positive?
You know, the question is the number of home test kits. We don't even know for sure how many home test kits are currently circulating in our community that have been bought online or bought at local pharmacies. But we know that there are a lot of people being tested at home, a lot of people getting the results of those tests and making a decision based on those test results. But we really don't have a good idea of the number of positive cases in our community from a home test kit.
On another issue, the Governor Parsons ending the state of emergency and the impact that's had on our healthcare workers. Have you heard anything back from the governor's office on him reconsidering that state of emergency?
Okay, so the question is about the governor's state of emergency. I know that I've been reading that governors in other states are considering reinstituting the state of emergency. I haven't heard that that is under consideration in Missouri. I know that the State Department of Health and the State Department of Health and Senior Services are both working with hospitals to try and modify regulations that make it easier for them to take care of patients in a crisis setting. And that's where we are today. We are in a crisis setting in our health systems. They are overrun. They have record numbers of hospitalizations. They are pushing the edges of record numbers of ICU patients, and there is no end in sight. The trend line looks like this is going to get much, much worse. But I know that state regulatory agencies who have jurisdiction over helping the health systems follow the law and take care of patients in a crisis setting. I know that they're looking at those regulations and trying to modify them. An emergency order by the governor would make that easier, but everybody's trying to get this done.
Have you gotten any, I think the last time I was here I asked you about the state sequencing about Omicron and Delta. I read an article in the Washington Post that Delta is still very prevalent in the Midwest. Have you gotten any sense from the state about how much of this surge is Delta and how much of it is Omicron? Are we kind of in the dark about the percentages there?
Yeah, so the question is about how much of the surge is Omicron and how much of it is Delta. That's a good question. We know across the country, what I've read and seen is that 95% of the cases now are Omicron, and that behaves differently than Delta. But in the Midwest, we do have a significant footprint of Delta. I have read some reports of healthcare providers in Southwest Missouri that a lot of their cases they believe are Delta, and we know that those folks get sicker. The difference between Delta and Omicron is, the Delta variant historically has been less transmissible, but the patients have gotten sicker. Omicron is more transmissible, and the patients haven't been as sick. The challenge with Omicron is that it's affecting, it's at this case, at this trajectory, it's going to affect everyone who isn't boosted, and a whole lot of people that have been vaccinated will get infected and maybe won't get as sick as they would otherwise. But the unvaccinated folks are eventually going to get Omicron, the way it's spreading. And a portion of those get really sick and get in the hospital and get in the ICU. The total numbers of people sick and in the ICU from Omicron will be greater than the folks that got sick and got in the ICU from Delta, because so many more people are going to be sick from Omicron. That's just how the math's going to work out. And we have to be doing everything we can as individuals, as a community, to get ready for this, to make smart decisions, put on your masks. Let's do our best to keep our kids in in-person school and help our health systems take care of patients, because right now they are really struggling.
My final question is kind of going hand in hand with that. I think that what a lot of people are worried about with Omicron is it's going to infect a lot of healthcare workers, and the staffing situation is going to be much sparser than with Delta, because from what I've read, if you're vaccinated and boosted, it protects you against Delta, but not so much against Omicron. Is there any talk about getting staff from elsewhere, or are they stretched too because of this? That seems to be the biggest issue here with Omicron, from what I've read.
Well, there are a lot of questions there, Jason. I'll try and walk through them. So you've recognized that healthcare workers are or people too, and they get sick. And a lot of healthcare workers are out on quarantine or out sick with Omicron. And we heard that, BJC gave us some numbers. None of those numbers are going to get better. They're going to get worse. And people are getting sick in every business sector, not just healthcare, but we're seeing a lot of restaurants, a lot of retail are shortening their hours or even closing for days at a time because they can't staff their businesses. The problem with the struggle with the hospitals and health systems now is that we see the numbers approaching and will clearly exceed what we've seen in the past with hospitalizations and ICU capacity. The difference today is that they have less healthcare workers to take care of people because our healthcare workers are sick, and some of them have just said, look, we're not going to do this anymore. We're burnt out. This is happening all over the country, and there is no bucket, there is no pool to go get more nurses and respiratory therapists and phlebotomists and all the folks that help take care of people in hospitals. There's nowhere else to go. Every place in the country's dealing with this. What you're going to see health systems do to try and manage this surge is they're going to be stopping elective surgeries, and I would expect them to start to limit outpatient services, not just surgeries, but outpatient services in general that are not emergent, and shift those staff over to the COVID response. And it's going to be difficult for people who are trying to get routine health care, routine not emergent health care, surgery or otherwise in the next month. And then it's going to be really difficult to catch up from that when we're past this surge. We hope sometime in February it'll be better. We just don't know.
Okay. Thank you.
Okay, thanks a lot.